Hey everyone, welcome back. Let's review delegation and priority for the NCLEX. First, let's make sure we understand the nursing scope of practice for the UAP, LPN, and RN unlicensed assisted personnel, UAP. Scope of practice, UAPs, including CNAs and PCAs, are primarily responsible for assisting stable clients with activities of daily living, ADLs, such as bathing, feeding, ambulation, and obtaining vital signs. Their role supports the nurse in providing basic patient care. Limitations. UAPs are not trained in therapeutic communication, cannot perform sterile procedures, administer medications, except in specific, highly regulated circumstances, not generalizable, or conduct patient teaching or initial assessments. Licensed practical nurse, US LPN. Scope of practice, LPNs care for stable patients with predictable outcomes. They can reinforce teaching initiated by an RN, perform focused data collection, for example, assessing vital signs, listening to lung sounds, administer most medications, excluding IV push medications and high-risk IV medications, perform sterile procedures, and insert, maintain, and remove NG tubes. Key distinctions. While LPNs collect data, the comprehensive assessment and evaluation of patient conditions, especially unstable or complex findings, for example, coffee ground emesis in an NG tube indicating a GI bleed, fall under the RN's scope. Per the National Council of State Boards of Nursing, NCSBN, LPNs generally do not initiate IVs or blood products, although some states may allow LPNs with specialized training to perform certain IV-related tasks. Registered nurse, RN. Scope of practice. RNs are responsible for the comprehensive care of unstable and acute patients. Their scope includes conducting initial assessments, developing nursing diagnoses, formulating care plans, providing initial patient teaching, administering high-risk medications, for example, IV insulin, with regular insulin being the only type administered intravenously, initiating IVs, and administering all blood products, including albumin and ROGAM. Core responsibilities. The RN's role is critical in identifying and managing patient instability, performing in-depth evaluations, and providing foundational patient education, ensuring holistic and safe care. RN responsibilities and delegation are the following. RN responsibilities and delegation are the following. Establishing nursing care goals. The RN is solely responsible for initiating and completing the overall goals for nursing care, guiding the patient's journey from admission to discharge. Initiating client referrals. Connecting patients with specialized services or community resources is an RN responsibility, requiring comprehensive assessment and planning. Regulating IV insulin. As a high-risk medication, IV insulin administration and regulation are exclusively within the RN's scope, ensuring precise titration and patient safety. Initiating security alerts. While UAPs may report concerning patient behavior, the RN assesses the situation and formally initiates a security alert, particularly in high-stress environments like labor and delivery, where family conflicts can escalate. Caring for unstable or newly diagnosed clients. The RN must prioritize clients with new diagnoses, unstable conditions, for example, a client with a subdural hematoma or an exacerbation of myasthenia gravis, or those recently admitted, for example, admitted 3 hours ago, as these situations require initial assessment and complex decision-making. LPN responsibilities and delegation. Checking NG tube patency. LPNs can check the patency of NG tubes as part of maintaining and monitoring these devices for stable patients. Caring for stable, routine clients. LPNs are well suited to care for stable post-operative clients, for example, 2 days post-op from an appendectomy, or those with chronic, well-managed conditions, as these tasks involve focused data collection and routine care. UAP, all staff responsibilities and delegation. Client ambulation. Assisting clients with ambulation, even with assistive devices like a walker, is a task that can be performed by UAPs, LPNs, and RNs. Assisting with the client baths. Providing personal hygiene, such as assisting a client in traction with a bath, is a fundamental task that can be delegated to UAPs or performed by any nursing staff member. Nurses are RN-LPN responsibilities. Checking bowel sounds. Both RNs and LPNs are competent to auscultate and check bowel sounds as is part of their routine patient assessment. Changing sterile dressings. Performing sterile dressing changes requires adherence to sterile technique, a skill possessed by both RNs and LPNs. The 5 rights of delegation. Adhering to the 5 rights of delegation is fundamental for ensuring patient safety and effective team collaboration in nursing. Right task. The delegated activity must be permissible by law and within the scope of practice for both the delegating RN and the delegatee. Right circumstance. The patient's condition must be stable and predictable, and the healthcare setting must support safe delegation. Right person. The delegatee must possess the necessary competencies, skills, and knowledge to perform the task safely and effectively. Right direction communication. Clear, concise, and complete instructions must be provided to the delegatee, including specific parameters, expected outcomes, and any necessary reporting requirements. Right supervision/evaluation. The delegating nurse retains accountability for the outcome and must provide appropriate monitoring, intervention, evaluation, and feedback regarding the delegated task, ensuring its proper completion. Common delegation challenges and solutions. Incomplete directions. A frequent pitfall in delegation is the failure to provide comprehensive instructions. For example, when delegating ambulation to an assisted personnel, AP, the nurse must specify crucial details such as the need for assistive devices, the number of personnel required, what observations to report, for example, patient tolerance, gait stability, and when to report back, for example, after each ambulation or at the end of the shift. Lack of follow-up and feedback. One of the biggest responsibilities in delegation is providing adequate follow-up and constructive feedback. Neglecting this step can lead to critical errors. Effective delegation requires ongoing communication and oversight to ensure patient safety and quality care.